we now find ourselves in a very polarized political situation, and we have a bill out there called the American Health Care Act. This bill is catastrophic for Catholic social teaching, and particularly for the people that we're called to serve. It will do incredible damage, and it doesn't matter who evaluates it, whether it is a right-wing think tank or a left-wing think tank, the Congressional Budget Office, or the Joint Committee on Taxation. 14 million people who had insurance will lose it in the first year. Over the life of the bill, it'll be over 20 million that will lose it. And in the first year, we will give over $15 billion in tax breaks to people who make over $1 million. That is antithetical to Catholic social teaching. Every pope in recent memory has made it explicitly clear that health is a human right. It is not a privilege. It should never be for those who can afford it. It is a human right. The Vatican Council, too, in Gaudium et Spes, the Church in the Modern World, made that crystal clear. So Catholic social teaching is not mysterious on this issue. It's a pro-life disaster in the fact that when you take health care away from people, you take life. The National Academy of Medicine, before we had the Affordable Care Act, did a very professional study and pointed out that in this country, because of the lack of access to insurance and then health care, we had in the United States of America every year 18,000 unnecessary deaths because people could not access health care. That is so anti-life. As somebody who spent a lot of time in hospitals and a lot of time in maternal and infant care, we know that so many times women feel like they have no option but abortion because they can't afford maternity care, and even if they could get maternity care, they can't afford to care for the child afterwards. And so if we want to really strengthen the pro-life culture in this country, you make sure people know that their lives and the lives of their child are so valued by our country that we give them quality maternity care, we give them quality pediatric care, and we surround them with programs like Head Start, like food stamps, that if they're in a low economic bracket, their child doesn't have to be doomed to malnutrition and a poor start in life. And so that's how you tell people life is important. That's really, for me, an indictment of this whole bill. Another thing that troubles me immensely, we're whipping that through the Congress without meetings, without hearings, without people who take care of the sick, without even hearing from the sick themselves. This is a really serious issue.